Turner, the Manager of Admin and Archives at the Redmond Historical Society. Thank you for joining us this morning for From Snake Oil to Vaccines, Pharmacy History in Washington State. Now this does mark the close of our current season of Saturday speaker programs, but mark your calendars for their return in September and keep an eye out for more information coming this summer. With me this morning is Program Committee member Emma Rockenbach, who will be monitoring the chat and assisting with the Q&A portion of our presentation today. Good morning, Emma.
Hi, thanks, Holly. I'm Emma Rockenbach, and I'll be monitoring the Q&A box for your questions at the end of John's presentation. In order to ask me questions during John's presentation, you can either use the Q&A feature or the chat feature. They are both at the bottom of your screen if you hover your cursor. If you use the chat feature, there's a drop-down menu where it says to, and then there's a little blue box. You can drop that menu down and you can choose to send your questions to just the panelists or to a specific person or to everyone who is watching the presentation, so all attendees. I will be monitoring both the Q&A and the chat, so if you send your questions to panelists or to everyone in the chat, I will see it. We'll meet our speaker and talk about pharmacies in Washington in a minute. But first, let's do a little practice to make sure our tech is working. Let us know if you can in fact see and hear us. Hover over the bottom of your screen to see the chat box and type a quick reply to let us know. And let us know a little bit about yourself. How did you hear about this program? Who is listening here with you today? And we also have a program-specific question. How many of you here have heard of pill bingo cards? Just take a sec. Yes, we can see you. Awesome. All right, we're getting some good replies here. So I'm going to hand it over to Margie Rockenbeck, who is representing the Speaker Program Committee. Margie?
Hello, everyone, and welcome. It's an honor to be able to introduce my friend and colleague, John Oftebro, as today's speaker. Many of you already know John as the president of the Redmond Historical Society. What you might not have known about him is that he's an expert on the history of pharmacy in the territory and state of Washington. John is a Washington native, and he grew up in Everett and Mount Vernon. In 1965, he graduated from Washington State University in Pullman with a degree in pharmacy. After some years of further training and employment in a variety of pharmacy settings, he bought Kelly Ross Pharmacies in Seattle, which he operated for 34 years. At about the same time he bought Kelly Ross in 1974, he moved to Redmond, where he has lived ever since. He retired from the active practice of pharmacy in 2008, but he has remained active in pharmacy education and history ever since. All during his career, John has held many offices of trust and honor in the wider community, too numerous to mention, but 3 are especially relevant to today's program. John is a past president of the Washington State Pharmacy Association. He's also a past president of the American College of Apothecaries, which is the national organization of independent pharmacists. And lastly, he served for 30 years as the president of the Washington State Pharmacy Foundation and Museum. John has always loved history. What I have learned by working with him on this program is that he has participated in making Washington's 20th century pharmacy history. He was active in supporting some of the important changes in pharmacy regulation, practice, and education in our state that have made the state of Washington a national leader in the profession. I hope John tells you something about that later. So without further ado, I offer a warm welcome on behalf of us all to today's speaker, John Oftebro. John?
Well, hey, Margie, thank you. And, you know, for all of you out there, when somebody assigns you the task of coming up with a program, you immediately begin researching it and so forth. And boy, when I did that, I found out that I was going to be presenting a program that probably should take, I would say, a semester at least. Anyway, I'm going to shorten this up so we can do this in 45 minutes instead of a semester, and go through an outline here to start with, just to kind of give you a framework of what I'll be talking about. So we're going to start out 12,000 years ago as our Northern Hemisphere was settled, talk about indigenous people's pharmacy, snake oil, go into compounding, that whole era, and then talk about pharmacy education, what pharmacies were here in the Northwest and Washington State and up to the current pharmacy practice. Talk about advancements in pharmacy practice, technology, and regulations as they all became a part of what you're used to seeing today. So this first slide shows what I'm sure most of you know. We were originally settled when our early peoples came over the Bering Sea Bridge, or may have arrived by some kind of a boat, but eventually populated North America and South America. And of course, we know of that population being here as early as 11,000 years ago when the Marms man was discovered in a cave above the Snake River. It was shortly after this picture was flooded. But what were they using as remedies in that time? Well, there was the shamans, the medicine man, the medicine women, probably in various tribes. They probably learned from watching birds and beasts and use cool water, dirt, leaves, mud, just about anything they had to alleviate their pains and sores. And probably then went through experimentation using nuts, roots, berries, and all kinds of other resources to help them with their plight. Well, I decided that this wasn't enough information, so I reached out to pharmacognosist, a retired PhD who's been a friend for years, and Jim Roberts loaned me some books, but the best one he gave me was this book on ethnobotany, written by Erna Gunther, The Knowledge and Use of Indigenous Plants by Native Americans. And you can see on this slide, there's 18 or 19 different tribes here who are represented in her work. And there was actually 2 pages that included all of these tribes and 120 or so different plants that were all marked off on here as what the different tribes used in taking care of their various conditions. So we're going to go through a couple of those. The first one is our famous Douglas fir tree. So she found out that the needles were mixed with cedar, boiled, and drunk for a cold medicine. They also boiled the bark and the roots and used those for colds. And the bud tips were chewed for sore throats. The willow trees that have been around forever, thousands of years, we've known that the bark yields salicin, which is nature's aspirin. But the Clallam tribe also made solutions from the buds that were used as an eye wash. The Mackay tribe used leaves as an antidote for shellfish poisoning. The Quinault used the gum from the burls on cuts and wounds. And the Squaxin made a suspension for sore throats. And you can imagine gargling a sore throat gargle made of willow. We've got better stuff out there today, but that's what they had. And here's the cascara tree, also known as sacred bark. It was indigenous to this area and grew plentifully out in the woods. And it's always been known for its very strong laxative properties. Those of us who were in pharmacy school knew it as kind of a joke, but the Skagit burned the bark, mixed it with charcoal and grease, and rubbed it into swelling areas in their body. And the Squaxin made a suspension to wash sores. So there's lots of references to all of this medication from natural sources. And for those of you who are interested, we'll be posting these references on our website so you can access other sources of medicinals from native plants. But what was pharmacy like in the 1700s in the United States? Well, Deborah and I visited this pharmacy years ago. As you can see from the sign, it's Hugh Mercer, Doctor of Physic and Apothecary. So it was very common for pharmacies in this era to be part of a doctor's practice, and that really was quite common. So as you can see, the interior of this beautiful museum, gorgeous glass fixtures on the shelves, and the top of the counter, there were an array of seeds and leaves and berries, numerous substances that you could feel, smell, and even taste if you wanted to get a real feel for what pharmacy, natural products, and other things were available at that time. But now we're going to shift to talking about snake oil. And in the 1800s, snake oil and other similar patent medicines were available in the Wild West. And you may have seen these in the various medicine shows, old TV westerns. And believe it or not, some of these patent medicines still existed in drugstores in the early 1900s, and a few of them might even be around today. These products, or at least most of them, were patented, but they were marketed without any proven effectiveness and were available without a prescription. Here's Clark Stanley's famous snake oil liniment. As you can see, it was good for rheumatism, sciatica, lumbago, contracted cords, insect and reptile bites, good for man and beast, and it gives immediate relief and is good for everything the liniment ought to be good for. And here's how it was sold. Step right up, folks, step right up. Only $1, we can cure just about anything you want to cure. And a couple of more examples, Sloan's liniment on the left, many hot active ingredients. And I know if this was rubbed on your skin, it would produce a warmness that would be very soothing to sprained muscles or whatever. On the right is swamp root, another popular one. A diuretic is for treating the kidneys and as a mild laxative. There were actually 17 herbal ingredients in this product. And again, most of them were wondering what they were there for, but they were there. But probably the most important ingredient is what you can see, 10.5% alcohol. So if it didn't cure you, at least you felt better about it. But I think the winner of all these was Lydia Pinkham's. Lydia had an opportunity to be quite a marketing person. And so she had her picture on most of her compounds. There were, again, herbs. She did have iron and thiamine in them, and they were all promoted for various women's ailments. Again, the liquids had plenty of alcohol in there, so at least you would feel better. But here's the disclaimer. These snake oil salesmen were not pharmacists. And while many of these products were still sold in pharmacies in the early 1900s, the 1906 Pure Food and Drug Act changed things drastically, as all the ingredients now had to be listed and false claims were prohibited. But now we're going to turn to the art of compounding, which was pharmacy and had been the art for thousands and thousands of years. It's the combining of 2 or more ingredients to make a suitable product for dispensing to a patient. And here's a caricature of somebody that looks a lot like Teddy Roosevelt, whipping up a little compound there. He's got ammonia, castor oil, ipecac, and looks to me like he's getting ready to serve it up to his patient, who looks like a pretty lethargic Congress. And here's an example of the early pharmacy storage of raw materials using compounding. These drawers were full of all kinds of incredible materials. And this is an actual, a picture of an actual set that we have at our museum in Renton. In it, you'll find hops, pink root, lobelia herbs, spearmint, black cohosh, and so on. But where were these sources from? And here's just one example of how they got in those drawers. The cascara tree was pretty prominent in the Pacific Northwest, and here's a gentleman out in the woods pulling off some of the bark so they would collect bundles of it, allow it to dry, package it up. They would find some kind of a jobber to sell it to, who then would sell it to the manufacturers, who would put it back into these little boxes and then sell it to the pharmacies. So here's one of those same drawers opened up with some water pepper from the SB Pennant Company. You can see white poplar bark on the other side. So what happened to this stuff? Well, it got compounded. And these are the important tools, the mortars and pestles that were used to macerate and mix the raw ingredients that then could be made into solutions and suspensions. Alcohol was also used to extract the active ingredients and serve up in the form of an elixir. And the more concentrated form of that were called tinctures, and they were available in little dropper bottles. So you would drop 2 or 3 drops into a glass of water. And other things that pharmacists did in those compounding days was put the powder into little powder papers and into a box, because that precluded really man-made pills and capsules. They also made lozenges, could create pills, creams, and suppositories. And speaking of suppositories, here's an antique suppository press that we actually used years ago at Kelly Ross. And the way it worked was this: if you wanted to put an active ingredient such as cascara into a compound, you'd usually use something like cocoa butter and mix it into the right proportions. And when it was in the right consistency, it would be put into kind of a tube area that had 5 little holes in it in a brass fitting. Then it would be placed into this, and the pharmacist would then crank away. And a couple of minutes later, 5 little suppositories would pop out the other end. And here's something interesting. These are antique pill rollers, also in our Kelly Ross collection. And I really never knew how these worked. Never did get a demonstration on it, but I found one on the internet, and I'm going to show that to you now. The audio isn't very good. The video is pretty good, but just enjoy this, and I think you're going to see how this works.
Remedy any ill. You just don't see places like this anymore, unless you happen to wander into Tomlinson's in Lytham. Here, they've preserved remedy any ill. You just don't see places like this anymore, unless you happen to wander into Tomlinson's in Lytham. Here, they've preserved 1.5 centuries of pharmaceutical curiosities.
Okay, and this one is gum sanguinis draconis, which is, in Latin, it's dragon's blood. We still have some. I don't know what it's for, but I take a pinch of it every morning. This is Creta precipitate, which is chalk and is still used as an indigestion remedy. The pill rolling machine will be used by the chemist to make up his own pills. He'd make the ingredient into some paste, put it on the pill cutter, and then just work it over to make it into individual pills.
So wasn't that cool? Now you know how to make pills in a pill roll.
Remedy any ill.
Whoops. But compounding is still in use today, but it's much different, as you will see on a later slide. The current definition would be something like this: a preparation of a custom formulation of a medication to fit a unique need of a patient, which cannot be met with commercially available products. And examples of this would be children's dosing, where the adult medications would be way too strong for an infant or a child, so they would be drilled down to the right concentration. Topical creams can be made without preservatives and dyes and scents that could be irritating to some people. Special injectables can be made, bioequivalent dosed hormones, sterile eye drops, and even veterinary compounding today is common in veterinary and compounding pharmacies. But before I leave this era of pharmacy, I wanted to show you something very special. Here's a leech bowl that was donated to our museum, and on the right is what would have been living in there. A couple of years before I retired, I actually had 2 inquiries in the same week for leeches. One was from Children's Orthopedic Hospital, where they had a young person with a serious head trauma and a hematoma, and they wanted to reduce that with leeches. And I referred them to somebody in New York, and the next day the leeches arrived, and it was a successful treatment. We also had a family friend whose son nearly had his thumb severed. It was patched back together and sewed up. There was considerable swelling, and they also used leeches. Apparently the room that he was in the hospital had to be kept at 100 degrees for 2 days while this worked. So now we're going to switch to the education of pharmacists over the years. And here's a drawing of what might have been appropriate in the mid-1700s. So here's a pharmacist actually demonstrating to these 2 young lads who may have been apprentices the same skill that you just saw in that video a couple of minutes ago. Apprentice in those days usually were in there following their pharmacists around for 4 or 5 years, and they were sent off to be on their own. But in the early 1800s, many of the states began writing early pharmacy laws to regulate the profession. And as a response to that, several pharmacists in Pennsylvania decided to take some action. They felt they needed a more more astute pharmacy teaching experience. So they developed the Philadelphia College of Pharmacy, and as an institution, it's still one of the leading pharmacy schools in the US. But they did that. A year later, 16 graduates of the Philadelphia College of Pharmacy were sent out on their own. And if you fast forward 70 years later, you can see the two pharmacy schools in Washington that opened up in 1891 and 1894. These schools gave 2 years of in-school study, didactic study in labs, and 4 years of apprenticing before licensure. The study included botany, chemistry, Latin, materia medica, urinalysis, pharmacognosy, the study of drugs from natural sources, and also therapeutics. But as pharmacy was evolving from the botanical to synthesized drugs, along came a lot of research and engineering advance, and pharmaceutical manufacturing really came of age. And in 1938, the Food, Drug, and Cosmetic Act was brought into being by Congress, later known as the FDA, and it was there to advance new levels and standards for safety and efficacy in the pharmaceutical industry. A lot of that was pushed by the fact that penicillin was beginning to be mass produced in that era, and it was such a blessing too for World War II injuries. And when that act went into being in 1938, there was actually an avalanche of 6,000 new drug applications over the next 10 years. And thalidomide, many of you will remember that one, was not approved in the United States after the many birth effects were such a tragedy in Europe. Over 10,000 births with significant birth effects. So to keep pace with all these rapid changes in the field, the faculties at the pharmacy schools began expanding their curriculum. So going to 3 years, then 4 years, and 5 years. When I was in pharmacy school, that was the deal. 1 year of pre-pharmacy, followed by 4 years of didactic learning and laboratories. And in 1995, it went up to 6 years, 2 years at least of pre-pharmacy. In fact, most of the students that are joining pharmacy school for the 4 years probably had a full undergraduate degree in biology and maybe had been out practicing in a lab or something else and decided to go to pharmacy school. And during these 6 years, there were 3 years of didactic learning, but the last year was totally experiential. So the pharmacy students would go out into the community. They would spend 4 to 6 weeks in an independent community pharmacy, a chain pharmacy, or in one of the many stations in hospital practice. And, when they were in school, they had different type of learning too. Here's the sim man, or in this case, the sim woman, the simulated woman. You see students working on blood pressure, charting. There's a port in the right arm for practicing giving injections and so forth. And you'll also notice that there's several women in these pictures. When I was in pharmacy school, 80% of our class were men. Most of us were kind of expected and wanted to go out and own our own pharmacy, and that has changed over the years. Nowadays, 75 to 80% of the students are women. And as it advanced, here's what pharmacy students were training for last year to prepare for active roles in testing and vaccinating for COVID-19. Well, over the years, pharmacy has evolved to many different types of pharmacies and drugstores, many of which you will recognize here. And we don't really have time to go into all of these, but if any of you have questions, I'd be happy to answer them later. But now we're going to turn our attention to the drugstores and pharmacies in Washington State and how they developed over the years. So you probably know the Arthur Denny party landed on Alki Point in 1851, and he was followed the next year by Doc Maynard, MD. So you might have thought that or expected that the first pharmacy in Washington was going to be in Seattle, probably operated by Doc Maynard in his medical clinic, but I can find no real evidence of his medical practice in Seattle, other than the fact he was known to be of great assistance in treating the local natives. He was also a very successful and dynamic civil leader and builder of the city of Seattle. But the first pharmacy in Washington State was actually started by a Dr. G.K. Willard in Olympia. And many of you may not know that Olympia was settled before Seattle in 1840. But for the rest of this little part of our presentation, we're going to talk about George Bartell and the influence that he and his family had on pharmacy here in Washington. George was born in Kansas in 1868. And he decided on a pharmacy career. He got a job in a pharmacy there, an apprentice for 4 years, was licensed, and he decided for some reason to move to Seattle in 1887, where he worked for a couple of years as a pharmacist part-time and other jobs. And after the Great Seattle Fire of 1889, he got a job as a pharmacist for a physician owner of Lake Washington Pharmacy. And he later purchased it when the doctor decided to sell it to him and concentrate on the practice of medicine. But in 1897, he decided to go north and experience the Yukon goldfields. He returned a year later, not rich, not poor, but with a definite goal in mind, and that was for expansion. But before we go on and talk about that, let's talk about what George may have been dispensing in his pharmacy at the time. It might have looked something like this inside. Besides compounding, there were mustard and capsicum plasters, bark from the cascara trees. There was pill rolling, as we've seen. He was also selling patent medicines along with spices and horse medicine. There was also crude opium available as a painkiller in many of the 19th century pharmacies. You can imagine pharmacies keeping a 15-pound block of opium on hand. And if a customer came in complaining of pain, that could be relieved by receiving a chunk of the block that was carved off by the pharmacist and handed to the customer. You just wouldn't see that today, would you? But the pharmacies were long and narrow, and they had high shelves, bottles of powder, drawers full of bark, leaves, seeds, roots, sassafras, hops, and so forth. They were definitely not self-service pharmacies. And here's another one. Caspar Hussey in 1865 began his pharmacy career in New York City. And maybe it was after the Seattle fire, but he decided to come west to Seattle and took his pharmacy, put all of these fixtures and glass tops and containers and equipment and everything on a train and headed to Seattle. I have no idea how it all got here in one piece, but he opened up a pharmacy on Skid Row and operated there for about 20 years till he moved up to 3rd Avenue. And it closed in the early 60s. And the owner at that point donated all these fixtures and supplies, signs, and everything to our State Pharmacy Association, and some of it now is on display at our museum in Renton. And if anybody wants a visit there, I'd be happy to lead you on that. But George's, whoa, sorry, it was too quick, and I've messed it. George's dream did come true because in 1898, he opened his second pharmacy. He renamed it Bartell's, and you can see in this picture, it said elastic bandages, trusses that fit, that were easy to wear. And part of the sign says Owl Drugstore, and that meant that there was a pharmacist on duty 24 hours a day. I guess he had the owl shift. This photo was taken in 1904, but here's the rest of the story. You may have seen this, but Jean Sherrard, who was one of the writers for the section on the back of the Pacific magazine of the time, Times that I love, the Then and Now series. Had a little article in there a few weeks ago, and I'm going to take part of that away and tell you that, that if you can imagine this, one day the door opened and this gentleman by the name of L.C. Smith walked in. And that was L.C. Smith of Smith Corona typewriters. And he probably greeted George and said, "George, how's business?" and so forth. And George says, "Well, Mr. Smith, it's just fine. We're doing well." And Smith said to George, "You know, I've got some news for you. I own this whole block. And in a year or so, I'm going to have you move because I'm going to build a very tall skyscraper here." And George said, "Well, that's just fine. I'd be happy to move. How tall is it going to be?" "Well, it might be 17 stories tall. It might be 42 stories tall." And he did build that. And you can see it here as the famous Smith Tower. Well, something else was going on in pharmacies those days. In 1902, George Bartell opened a soda fountain. It was the first soda fountain in Seattle. They had been quite the rage over the years on the East Coast, finally got out here, and were very, very popular in pharmacies up through the 20s and 30s. At any rate, they were the home of the soda jerks. And here's a soda fountain in a pharmacy that progressed a little bit. This is now a self-service pharmacy where you could walk in and get tobacco and candy on the right. You can see the cosmetic department. Beyond that, there were gifts and probably greeting cards. Looks like some flowers in the back. And way in the back was the prescription department. Well, here's some innovations that came from pharmacy. These three popular things that are out there today, and all big Fortune 500 companies actually started in pharmacies and probably in their soda fountains. So 3 different pharmacists in Southwest USA came up with these inventions in the late 1800s, actually. And you may or may not know this, but cocaine was one of the ingredients, at least in one of these. So if you want to vote in on your little chat or Q&A thing, you can tell me which ones you think had cocaine in them. And when you think about it, it was probably a pretty good additive because his customers were lining up every day for a refill. 1916 was another important year because George Bartell Jr. was born. And it was also the year that on January 1st, the state of Washington went into prohibition. So alcohol was not legally manufactured or sold or drunk, of course, but that's not true. But there was an exception to the rule in Washington, and that is if you had a prescription from a doctor, you could get a liquor alcohol prescription. And that went on for a year or two, and that was changed, but there was still many, many tonics out there with up to 22% or 44 proof alcohol in them. And innovation still was going on out here too. L.D. Bracken was a pharmacist who opened a new pharmacy in a medical building on the corner of 4th and University in 1921. And he came up with a formula to treat cold sores, fever blisters, and chapped lips, and sold it probably in little tiny jars in his pharmacy. But he was on the way to Chicago for a pharmacy convention and ran into a gentleman who was also going to the same convention and selling empty ointment tubes. So they struck up a conversation. By the time they both left Chicago, the other gentleman had the formula and would be producing and marketing Blistex. But Bracken was smart enough to keep the license on the name of the drug and the royalties that would go along with it. So 1925 was also an important year because Bartells were on their way to New York City. And it was George and George Jr., who was 9 years old. And they got there and were involved in many of the meetings. And George was soon approached by the Liggett Company, who had the Rexall store brand. And they were populating pharmacies all over the country by that time. And they offered George $1 million for the 10 stores that he had in Seattle. But George is a pretty smart guy. He wanted to consult with his 9-year-old son, George Jr. George, what do you think? And George Jr. said, Dad, no way. We're keeping it. We're going to prosper this on our own. And here's another important year in 1925. A developer decided to build an 18-story medical building on the corner of 5th and Olive in downtown Seattle, right up against a building that was already there called Frederick and Nelson. And the first half of the building was going to be built in 25, the second half in 1945, and eventually have 150 doctors in there. So they were attracting numerous pharmacists to vie for the position of owning the pharmacy in the building. They whittled it down to 2 people. They couldn't decide. One's name was Kelly, one was Ross. So they shook hands, became partners, and built an incredible business that lasted over 2 generations. And so meantime, the Bartells got back into the business. Here's store number 11 that was opened in University Way, 1929. They went forward and opened up their Triangle store, which is quite famous in what is now Westlake Park. They did some tremendous merchandising and had a pharmacy, of course. And the top floor was a diner. So Bartells actually grew their early soda fountains into fine dining establishments, which were very popular. But something happened in 1960, 61, 62, and they were building the Seattle World's Fair, and there came the monorail right in the back door of Bartells Pharmacy. But now we're going to switch to talk about Redmond's early drugstores. And in this slide, you can see a little thing up in the corner where Redmond Drugstore had an ad. All you need to do is dial 201. A little more complicated today, isn't it? And you can bring in your radio tubes, let them test them for free and probably sell you a replacement. So this building was on the corner of Cleveland and Gilman, and you can see the 2-story brick building in the back, which was the Bill Brown building, his famous saloon back in the day, and today is the Matador restaurant. It also was the home of Allen's Drugstore for several years. Unfortunately, Allen's went bankrupt during the Depression, but it was used by the Redmond City Council for a couple of years to have their council meetings. And here's Bechdel Drugs in a beautiful Art Deco building. It was right around the corner from Dr. John Way's clinic, who was one of the early docs in Redmond at the time. Today, you might recognize it as a vacuum store, but it's right next to my favorite bookstore, McDonald's Books. And then in 1941, Pete Douglas came to Redmond. He and his wife moved from Cedar Woolley, bought a pharmacy that I think was right across from the Bechdel store. He was a very important civic leader and actually was one of the founders of the Redmond's Lions Club. But he had a dream of building out a beautiful new pharmacy, which he did, and moved his business to the V&B Shopping Center. Some of you might know it as where Value Village used to be, and that was in 1947. Unfortunately, he passed away 6 months later, and the pharmacy was taken over by Phil O'Reilly, who operated there for years, and eventually in the Redmond clinic. But just wanted to shout out to anyone out there from Redmond or used to be from Redmond who had any information on some of the early pharmacies there. We're looking for more information as we collect and preserve Redmond's history. So if you have any of that information, please put it on the chat line or get a hold of us later. So now we're back in Seattle at Kelly Ross Pharmacy. So this is a picture from 1945 that the pharmacy moved across the hall, was greatly expanded. And in 1965, my buddy Larry and I walked in there. We'd been looking for jobs in Seattle prior to graduation. And we took one look at this fancy pharmacy and said, geez, we'll never get a job here. So we left and went down to the corner, flipped a coin, and Larry went up the street to see if he could get a job at Pain Safe. And I walked up the street to Boren Avenue to the Bartell headquarters, walked up a couple of flights of stairs I met George Bartell Jr., and he introduced me to people who interviewed me for a couple of hours, and I came away with a job that would start in July after I graduated. And of course, passed the state board, which I did. And my first job was at Northgate. This Bartell store was actually built when the shopping center went in 1951. And I spent one day there, and then over the next 6 weeks, worked in 6 different Bartell pharmacies until the man who introduced my parents and owned a pharmacy just 2 doors down from this Bartell's was in the bottom floor of a 40-doctor clinic with a hospital upstairs, and Sandy offered me a job that I couldn't refuse. So I left Bartell's and drove into this parking lot every day for 2 years, passing this incredible totem, never thinking anything about where it came from or who carved it, until 2 years ago when I was formally introduced to all of the incredible sculpturing by Redmond's pioneer and well-known wood sculptor, Dudley Carter. And it can't be seen at Northgate anymore. It was moved a few years ago, but now it probably sits at the Squamish Clearwater Casino over on the peninsula. So here's an example of another small pharmacy and a medical clinic. There were 3 or 4 doctors in the clinic. There were two dentists, and it's a 1 pharmacy shop. There was a delivery kit in the afternoon, and it's just another example of a small apothecary or pharmacy. Excuse me, but that was me. And the drugs of the day were something like this. You see the Valium, but there was Premarin, hydrocortisone, Percodan, Darvon, and compounded, as far as I was concerned, was nothing I'd be doing again. Valium was such a popular product after being introduced in the early 60s, actually was the top selling drug in America for 14 years. And after 8 years of practice experience in North Seattle and a short business experience in Bellevue, I joined Kelly Ross Pharmacy as quickly became a partner. When my partner and mentor, Rod, went on to another career, I had some challenges because most of the doctors in the building were moving out and joining large clinics up in the hospital segment on Pill Hill. And so I expanded to 4 other pharmacies just to keep the business, and began offering specialized services in nursing homes. Durable medical equipment was part of what we offered, ostomy supplies. We went into the hospice pharmacy business and home IVs, and basically any niche that was out there, we took on just to keep our head above the water and competitive against a host of growing competition. So these next 30 years were an incredible growth span, and we just don't have time to cover it all, but just to touch on the competition, the Bartell chain had now grown to 45 stores by the 90s. And by 1993, Pay and Save, the big competitor in the area, had 124 stores up and down the coast. They were bought out by Payless, and after that, Rite Aid. So that's what happened to Pay and Save. And you can see all the other practice changes that happened with the advent of technician, new pharmacy practice advances, computerization, and so forth. And right at the bottom is robotics. And did you ever think that you would be getting a prescription filled by a robot? Well, it's out there nowadays. You may not know it, but it could be happening in your pharmacy because there's a lot of robotics out there. The one on the upper left has a couple of 100 different drugs in it, the fast-moving items, and you can see on the right, those are dispensed in the pill bottles that you would normally get. Below that is a machine that fills 8 bingo or blister cards with either 1 or many medications, depending on the card. And those are generally used in nursing home and assisted living facilities. Upper left is another machine that puts out strip packages. You see on the right it's individually marked. Might dispense a week's worth of at a time, and each day has 4 different dosing times: breakfast, noon, dinner, and bedtime. And all of this was barcode driven, which is much more efficient, much safer. You can see a more modern pharmacy on the right. Meanwhile, Bartell's continued to grow. Here was the store they built in 2010 in Lake City, number 66. And they eventually got to 69 stores. And as you may know, the family chain sold out this last year in 2020 to Rite Aid, closing a really wonderful era of the last small family-owned chain that was emphasizing wonderful service. They were excellent competitors and colleagues for those of us who are out in the profession. So here's a pic of modern compounding. The Kelly Ross Pharmacy now is a state-of-the-art compounding lab for the preparation of custom medications. And you just wouldn't believe the number of rigorous standards that are out there that need to be followed. Credentialing is very difficult, and the regulations are intense, but it's all there for the safety and efficacy of the prescriptions that are turned out. And here's Harborview Hospital. I worked there inside the one building. It was the only one in 1969. I worked there for about 6 months. And there were 4 pharmacists. We mainly filled prescriptions to patients who were walking into the clinic, and sent medications up to the various floors upstairs in bulk. In fact, we weren't even allowed to go up into the floors. And I know I got in trouble one day for going up there and trying to figure out where all the Valium was going. But pharmacy has changed over the years. And here's the entire campus of Harborview today. Today, there are over 50 pharmacists working there, and they work in the ER and critical care, the burn unit, infectious disease, oncology, and many, many other specialties. They go on rounds with the docs, and they are consultants to them on the appropriate medicational therapy for the diagnosis that the docs come in with. But before I finish today, I wanted to close with a mention of some of the important timeline events that happened causing the changes of pharmacy. And this just represents some of them. But in 1890, the Washington State Board of Pharmacy was established to govern the professional and legal affairs of the practice. We're largely self-governed and are constantly helping to advance the laws and regulations that make our profession so prominent in today's fast-changing healthcare system. For many years, pharmacists have been the #1 ranked healthcare profession, and we're certainly the most accessible healthcare professionals today. So from the dangerous products like this one with its unlabeled morphine that killed many children, the 1906 Pure Food and Drug Act began a series of changes as the drug industry evolved. Through the prohibition in 1919, the formation of the Food and Drug Administration in the 30s, into Medicare in 1965, the changes have become fast and furious. And here's LBJ signing that bill, and he's also filling out the very first Medicare card that would go to Harry Truman, who was president, tried to get Medicare or something like that going as early as 1945. And in the background is a pharmacist. It's Vice President Hubert Humphrey, who actually worked in his father's pharmacy for 4 or 5 years after being licensed, but he decided to go into politics, and like Teddy Roosevelt, decided to offer his compounding to Congress and the country. So just so you will know, Washington State has been on the forefront of many of these changes, such as the updating of our Practice Act in 1979 that enabled us to be the first state to eventually allow for pharmacist immunizations in 1994. We also established the model for nationwide immunization training. In 2012, the first pharmacy in the United States to provide home take-home naloxone kits for opioid overdose poisoning was Kelly Ross, and since then they have distributed over 10,000 doses to individuals, first responders, police, and school districts. This intranasal dose rescue kit gives victims valuable minutes until first responders arrive after 911 is called. In 2014, Kelly Ross launched the PrEP program, which is a pre-exposure prophylaxis for HIV infections. The one-step PrEP was developed for pharmacy use by Kelly Ross and presented to the Center for Disease Control and is now adopted by pharmacists across the country. Patients receive one in-clinic visit every 3 months with their pharmacist to establish and maintain their treatment. And in 2015, Governor Inslee signed a bill that paved the way for pharmacists in Washington being recognized as preferred providers and finally being reimbursed for expanding practice activities such as patient counseling, in-home training visits, brown bag events, diabetes management, immunizations, PrEP for HIV, and the like, and actually be paid by the medical insurance plans. So here's that list again. The green lines below are the ones that originated in Washington State. And while we don't have time to discuss all of these in detail, they will be posted on our society website. I wrote a short paragraph under each one, so you can find out a little bit more about that by signing into the Redmond Historical Society.org. And finally, I got to retire in December of 2007, turn our business over to my son Ryan and watch him and his partners continue to enhance the profession going forward. So thank you very much for attending, also for attending the various other programs we've had this year, and hopefully we look forward to seeing you in person in the future. I know I would have much rather been looking at your smiling faces out there as I delivered this. So I'm going to stop here and going to turn it over to Emma, who may have collected a few questions, which I will try to answer for you.
Yeah, so we actually have some really good questions today. Let's start with a quick clarification. So John, you said that pharmacists are ranked the #1 medical profession. What is that ranking? What do you use?
Well, I don't know. It was popular in all of our trade magazines over the years, up until a few years ago when something happened in the pharmacy profession. It put us down to #2, but well, we were patting ourselves on the back. I don't know who. Maybe we were tapping ourselves on the back, but we were right up there.
We also have another question about why Washington State in particular is a leader and such a leader in the pharmaceutical world. Is there anything that explains why it's such a kind of disproportionately high?
Well, first I have to say, well, anyone out here who graduated from WSU University had a heads up on any other part of the country. But seriously, pharmacists in the practice, in the colleges of pharmacy, members of our staff, of our pharmacy association and so forth, worked together for years with other community groups to find ways to enhance some very unutilized and education of pharmacists. And so in 1979, after that law went into effect, it actually took 15 years for us to finally come up with a way to set up the immunizations and so forth. So that was always a struggle. And that law actually started a series of agreements. It's called the Collaborative Drug Therapy Agreement. And these agreements were between pharmacists and physicians, or ARNP, and they were meant to strategize what a pharmacy could now do in its practice. currently there's about 30,000 of these that are out there in Washington State. They need to be renewed every couple of years. And in addition to what I've covered already during the slides and immunizations and so forth. And I'm going to have to read you this list because I can't remember it all. Collaborative agreements help patients with the following diseases: allergy, anaphylactic reactions, anemia, microbial infections, anticoagulation, nausea, viral infections, chronic disease management, diabetes, drug dosing and monitoring, emergency contraception, hormonal therapy, gastrointestinal disease, hyperlipidemia, pain management, refill authorization, asthma, tobacco cessation, and more. So if you're interested in learning more about this, I'm going to post a full description of all of these activities on our website too. Hope that explains it somewhat.
Oh yeah, that's great. Ooh, here's a good one. So what percentage of pharmacists work in privately owned pharmacies in Washington presently?
Oh, a small percentage. And back in the 60s and 70s, boy, it was probably 3/4 of the pharmacists were in independent pharmacies. And as chains took over and started making more competition heavy for independent pharmacists, the pharmacies closed or were sold out to competitors. And so that, I don't know, the percentage now is probably 15 to 20%, but smaller. We're still strong though.
It's definitely different. We have a number of questions about the museum in Renton that you helped start. So I'm wondering actually for the other program members, if we can make sure that that is posted in the after program notes, information about how to find.
Okay.
Is that something?
Yeah, sure. We moved into a new facility there about 10 years ago and we're able to improve our display of a lot of these things that you've seen, patent medicines and various other things. And currently, of course, we're not open due to COVID-19, but hope to be, in the fall or by next year. But anyway, if anyone's really interested, they can get a hold of me and arrange to give them a tour.
Awesome. Go. So did the logging industry have any influence on the development of the pharmacy in the state? And if so, how much and in what ways?
The what industry?
Logging industry.
Oh, the logging industry. I don't know about that, other than the fact that my grandfather was an early logger and his grandson, me, went to pharmacy school.
So obviously quite a big impact.
Yes.
Yeah. We actually have a number of answers here I just want to go through before I ask the next few questions. A lot of people said Coca-Cola for the drink that contains cocaine. Is that correct?
That is correct, and it's half correct because it was also Pepsi-Cola.
Yeah, I believe I heard on a podcast that the cola part of cola is from the cola nut, which is also a medicinal nut. So there's at least two things.
Yeah, those formulas were so incredibly secret. Coca-Cola, it's long held the fact that parts of the formula were in various safes and so forth, and some people really never knew the whole formulation. That may have been yours too.
See. So someone's asking, is it hard to get into the School of Pharmacy?
Oh, good question. In the 60s, it was relatively easy. There were, 50 or 60 pharmacists in my original class. We ended up graduating 27. Today's classes are more like 100 or more in both the schools here in the state. But at least 300 students are vying for one of those 100 seats in each class. So it's very, very competitive. Experience, good grades, being a great person, great personality, all those things come into effect as students are chosen.
Yeah. So I'm not sure if this is referring to the past or present, but how would a patient or customer know if they needed a compounding or other specialty pharmacy?
Well, that's a good question. So as far as compounding, if a patient was seeing a doctor and was sent off with a special formula that wasn't available normally, the physician normally would steer that person in the direction of the compounding pharmacy. Or if they didn't, or the patient was confused, they might end up in a chain pharmacy or an independent pharmacy who wouldn't be able to compound it, and so they would refer them to a compounding pharmacy. The specialty pharmacy, those drugs are so expensive. We're talking about drugs in the neighborhood of thousands of dollars, $10,000. And generally those are to a very specialized pharmacy that can afford to stock those drugs and knows some of the particulars about their dispensing and use by the patient.
So you have some questions here about those bingo style cards. You showed a picture briefly of one of those blister cards. Can you explain a little bit more about what that's about? Is each of those like a day's worth of medications all gathered together?
Sure. Yeah, good question. So typically they're available, as I mentioned, for nursing home or assisted living. So there'd be a separate card for the morning dose, the noon dose, the evening or supper dose, and the bedtime dose. So there might be 5 pills in morning dose, 2 at lunch, 2 at dinner, and 1 at bedtime.
Okay. Yeah, so you have some people jumping off of the last answer you gave about getting into pharmacy school, and someone's wondering why they make it so exclusive and if that is causing a current shortage of pharmacists.
Well, I don't know if it's exclusive. There are many pharmacy schools across the United States. And it's funny that over the years, the supply and demand for pharmacists has gone up and gone down. Maybe going up now with everything that's going on, but it isn't really exclusive. There's just kind of a containment in terms of those numbers that needs to be controlled somehow. The fact is that there's so many students who want to go into pharmacy, the pay amount, which could be somewhere in $100,000 a year, might be quite a bit more than the same person with a undergraduate degree in biology or some other science and was working in a lab somewhere for quite a bit less than that. So it's a great career, many opportunities, not just in retail pharmacy, where most patients see pharmacists, but in all kinds of other settings.
Yeah, that makes sense. We have someone asking for a clarification between the difference of an apothecary and versus a pharmacy.
Oh, I knew somebody would ask about that. So apothecary is a term that actually came from the Greek language and was popular in Europe for centuries, especially France, Germany, and so forth. France kind of got rid of it. Funny story, I guess probably in the 17 or 1800s, when there were a lot of those caricature jokes, could have been like the Teddy Roosevelt one where the apothecaries were made fun of. So in France, they kind of changed it over to pharmacies, and it's still popular, as is chemist in Germany, to be an apothecary. But it kind of moved to the United States when it began being settled and so forth. So apothecaries came over, and it was kind of used interchangeably. And then as progress went along, the word pharmacy or drugstore kind of took its place. But in 1940, a group of pharmacists who were upset with all of the cut rate pricing that was happening out in the community, and some of these pharmacies formed their own organization, and they called it the American College of Apothecaries, which is one of several different organizations. Actually, it's a smaller one than some of the big ones. In fact, all the names have changed over the years. The National Association of druggists. It used to be the name they use, and now it's pharmacists. So name changes.
So someone's saying that there's someone named Al Ross at Lakeside Drugs in Redmond. Is that something you know about?
Al Ross, yes, tall Al Ross. Lakeside Drug was in the QFC Center by Trader Joe's for many, many years. Al was a great pharmacist who worked there at Lakeside, and that store ended up being Pharmacia, which it is now. But Al retired a few years ago. Great guy.
Oh, awesome. Yeah, I know that exact store. That's cool. We have here a question I think is from a friend of yours. Hey, John, can you give me some free COVID advice? Will snake oil work as a substitute vaccine? El Cocho.
Absolutely. Just come on down. Take care of it.
All right, so I have time for one more question here if anyone wants to throw one in. Otherwise, I think we're about time to end.
I have a question.
Yeah.
John, you were talking about something called naloxone, which was for slowing down an overdose. How do people get that? Who has them, and how do you get that so it's available if somebody overdoses?
Well, it's available now pretty much as a handout. Ryan has been distributing them to all kinds of places, teen centers and everything else. And when they originally came out, there was a required training period by the pharmacist, but all of that's been relaxed just to meet the needs of having it available for anybody who wants to have it. And of course, that little squirt push thing is so easy to administer. One quick squirt in a nostril followed by the second one in the second nostril, and buying that extra time is just incredibly valuable. So I'm not sure where all the sources are, but if anyone called Kelly Ross Pharmacy, they would be able to find out from Ryan's team. The other thing that's important to know is that many of these are, of course, because of illicit drug overdose. And there is a Good Samaritan law in Washington that prevents anything happening to people who are associated with the illegal drugs during that time. So it makes it safe for people who might fear, oh, I don't want to involve with somebody because what if? But it's important. It's just saves so many lives. It's amazing.
John, do you need a prescription for naloxone?
You do not. You just need to get it from a pharmacy or somewhere where they have dispensed it. And it could be from a fire station, police station, or whatever. Again, I don't have all the details on it, but it's out there. Thank God.
Yeah. Those Good Samaritan laws are really important. We had something like that on my college campus for if someone had a drinking issue, if someone was sick from alcohol overdose, no one else around them would get in trouble for calling EMT in. All right. I think that's time for questions. So hand it back to Holly.
Alrighty, well, thank you, John, Emma, and Margie for another great, really interesting and informative Saturday speaker series program. As I mentioned, this does mark the end of our current season. We hope you've enjoyed our presentations and our speakers, and we hope you'll join us again in September when we return with a fresh lineup of speakers and topics. Right now, we are planning to continue hosting our programs virtually until it's considered safe to meet in person, but stay tuned for more announcements this summer. And meanwhile, our office and museum space is taking shape at the Old Redmond Schoolhouse. We're hoping that we can welcome our guests back in sometime later in this year, but right now our volunteers are hard at work preparing things for that reopening. And one final announcement, save the date for our first ever virtual fundraiser, We Love Redmond, on Friday, May 7th at 6:30 p.m. So keep an eye on our website and on our e-newsletter for more information on that event. Thank you all for joining us today. And if you have any questions or feedback, you can write to me at manager@redmondhistoricalsociety.org. And please let us know if you like the program on our Facebook page. Until next time, take care.
Thanks for tuning in.